Good morning, everyone. I would like to present you my presentation. I would like to say thanks to some women. Tineke Eben. Tineke Eben introduced me to the Art of Living Foundation 10 years ago. And since then, she's been very special in my life, and as well as the Art of Living Foundation today. I also would like to thank Surajita Kulkarni and Banu Didi. They invited me to do my presentation today. I'm so honored. Thank you so much. The land of India has made me so beautiful, has made our feeling so special. So let me lead you through my presentation. I would like to, as you see on the slides, I will only show some images, and then I'll go through my story. These are the images that inspire me very much while coming to India. First, I will briefly make some general remarks, and afterwards, I will try to go on my own experience and my current position in Erasmus University Hospital in Rotterdam. So, you know, changes these days in healthcare, they gradually happen. When I started years ago, technology was there, but it wasn't very special. The doctors were the physicians were the one who started doing everything, and the nurses had to follow. I started my career in healthcare as a nurse. And afterwards, I decided, just don't be a nurse anymore. Try to influence what's going on in healthcare. Try to see if you can make a difference. My mom always told me, she said, listen, whenever you get up there on stage and you want to make a difference, it doesn't have to be huge. It just has to be this tiny bit. And when you turn around and you look back, the age passed, you know you did that little thing that helped you and helped your community, and especially women, to move forward. And that is the reason why I am healthcare today. What happened over the years was something that I didn't even recognize. I started in healthcare when I was 17 years old, and we started doing blood pressure. I started counting the breath with the hourglass, the drip of the IV, and all those type of things. And gradually, when I was in Amsterdam at the University Hospital de VU in Amsterdam, they asked me to participate in a board to be like a feedback board for the manufacturer who makes those IV pumps these days. And so we started at the grassroots. We were pioneers. And I'm talking about 1981. And that's a long time ago. After that, the technology started going fast. And the faster it got, I tried to catch up, and my colleagues also did. But sometimes we felt like we were losing track on everything. Now you're seeing these charts. You know what happened? All those pulse, the breathing, the eye drip and everything, now we always stare at the monitor. And sometimes we forget that we always had the paper and the pencil to write it down. We had the clinical touch, the clinical observation, and the women intuition. That is what we need in healthcare. Besides the monitor, besides all the technology that is there, we need to have the dynamic interaction between the intuition, what you feel inside, besides, it doesn't matter what the chart says. If you look at the patient and you see that something is wrong with the color or the breathing or something else, and it is not registered yet on the monitor, you yourself can make a decision and call the physician or do something else. That is what we need in healthcare. You cannot substitute those charts for human interaction and back and forth. That would not work. There are some other shifts that have been made. The shifts in how we address our patients in the organizations and out of the organizations. We talk about people as if they are a disease. You say the patient with the diabetic and the heart failure and one in room 3. And one with a broken leg in room 4. That's how we do it these days. That's not good. We need to get to the grassroots of what we are as women. We know how to communicate with patients in the hospital and out of the hospital. We interact and we get closer, we talk, and we combine. And that is very important in healthcare. That is nothing you can get that into technology. That wouldn't work. The robotical technology at this moment, we're trying to be very smart to get the people to interact with each other, but the robot only go, ah, that's it. But we go, ooh. And then we feel it. So the chuck thing does not work. It would never exchange the warmth, the feeling. So that is the basic thing. I just mentioned my technical insight started at the hourglass. So you should see why it started. Because everything afterwards was something that was just evolving. I just mentioned that. Let me start with this, a woman's thing. You know, I just mentioned that my mom said, you have to make a tiny difference. A mammogram, you know what's a mammogram, a mammography? You know that men thought about how to do that for women, how to make a mammogram, and you know how it hurts? They take your boobs and they squeeze it, put it onto the Röntgen photograph. It hurts terribly, and then they make the picture, and then they say, you have nothing there, or you have something there. And that way of doing a diagnostic for women is one of the things I'm very interested in to change the diagnostic techniques. It's a screening technique we all have, and we need to change that. Fortunately, I'm in a university hospital in Rotterdam where we can experiment a lot. There are very passionate people working there, and they know this was the first thing I asked some of the researchers, can you help me, together with Philips in Eindhoven, to think about something that would reduce the pain for women when you're doing a mammogram? And they said, Elisa, we'll think about it. You know how much that costs? I say, it doesn't matter what it costs. You know how many women there are in the world? They say, yes. There's another thing, what is very important. I don't want to talk about the internet and Facebook. We had a lot about that the last days, right? I'm going to talk about the advance, what goes beyond these type of diagnostic methods and machines. I would like to talk about the MRI. Everybody thinks the MRI is the breakthrough of diagnostic, but there is more to come. There is more to come. The MRI is the breakthrough indeed. But what happens after that, beyond that? The MRI is made to be combined with other therapeutic interventions. For instance, cancer. In cancer, you can see the tumor via the MRI, but you have to need a precision beam to pinpoint the cancer and try to radiate it so that it would reduce or remove. So what happens now? We are doing a research, Erasmus University and some others. We have a strategic alliance between the TU Delft, the Leiden University, and Erasmus. They call the Medical Delta. We're going to try to use proton, a beam, to pinpoint where the cancer is, in combination with the MRI, to at least get the cancer tumor the right way around and don't damage the healthy tissue around it. And that is what is coming up within a couple of years. That has to be done. Another thing we're doing is with the MRI in combination with a cyber knife, they call it. A cyber knife is also a beam. It's stronger than laser. It is not really a knife. It's non-invasive. It doesn't go into the skin. It's not a surgical thing. You do it like radiation. You go into the MRI, the beam comes, they look and see where it is, and when it hurts, you know, some people when they have cancer, they have a severe pain. No tablet, no morphine doesn't work. Then you take the cyber knife and some other immune system type of therapy products. You put it into the beam, you put it onto the thing, and that's it, it goes. The MRI is the basic for the advanced technology. It goes beyond what we are thinking about these days. And all this information, everything what is going to be coming out of the results of those therapeutic things, you're going to find it on your computer. You're going to find it on your telephone. You're going to find it on your laptop. You can have it bedside. So these connections are web-based. There's going to be a dynamic interaction in technology in healthcare these days. Don't ever forget what I'm telling you today, because maybe in 2-3 years after, it's going to be normal. We're not pioneering no more. And the last thing, finally, conclusion, one more example. Diabetic. We all know that that is becoming one of the world #1 diseases. We developed, Erasmus University developed together with Philips in Eindhoven, a diabetic station. It's like a small house. It's not so big. You can connect it. Now they're doing advanced connections. You can connect it to your computer at home, your stove, your engine, everything. You go, you put your hands in. It does your blood pressure. It sees how your blood sugar, the level is. It makes the analysis, and it's transported to you. It's a self-management and a little thing. You can just do it on your own. We hope one of these days it would be everywhere in the world to be used. So I thank you. These are the examples I would like to give. Thank you so much for this.